Local programming on KRWG Public Media made possible in part by viewers like you. Thank you.
Hello and welcome to Fronteras, a Changing America. I'm your host, Anthony Moreno. Today we talk education and community. We will discuss early childhood education and also learn more about a partnership in Doña County that is working to provide education from prenatal to a career path. We now hear from two people who have been working together on these issues. Please welcome Engage New Mexico Executive Director Lori Martinez and Erica Surova, Senior Program Manager for the Center for Community Analysis at New Mexico State University. Thank you both for being here.
Thanks for having us.
Well, it's great to have you both to talk about such an important issue here in studio with us. Now, I'd like to start off, if you could share with our audience a little bit about the partnership and how you work together and how it also starts with and fulfills the mission of your organization. So Lori, why don't we start with you?
Okay, sure. Well, Engage New Mexico, our mission is so broad that really we could focus on anything, but our focus right now is on education from prenatal to career. So that is the Success Partnership, and the focus is intended to be prenatal to career, advancing outcomes in the county. So we all know education's a huge issue in New Mexico. And we often have, not just here, but across the state, we often have organizations and programs that are operating kind of in isolation from each other. And so our goal with the Success Partnership is to pull in all these partners across that education spectrum and really leverage those collective resources that we have and get everyone aligned and moving in the same direction together. And so we call that our community agenda, which is the prenatal to career focus. And so the idea is to increase outcomes by really deep dive collaborations, by shared measurement, which Erica will talk about. So the data piece is really important, and by looking at those natural areas of alignment and crossover. So there's a lot more I could talk about, but that's kind of the general.
No, that's perfect. I like to now hear from Erica a little bit about data and how it's the work you're doing and how it's kind of shining light on the gaps we have right now in education.
Sure. So we've really, one of the things we recognized early on was that the community didn't really have a partner that was dedicated to collecting and analyzing data specifically for nonprofit organizations and really looking at what's going on in early childhood education in the community. And so our role has really been to support the work of these other organizations, and if they have data needs, for example, looking at the gaps in early childhood education in our county, we've played that role in partnering with them and looking at, whether it's maps or collecting data directly from partners to really see what's happening in our community and give that back to nonprofit agencies. And
there's been such a big stress on improving early childhood education in our state and getting more students in an early childhood education program. What are we looking at right now as far as the numbers go? I mean, are they trending upwards? Can you kind of share where we're at right now? And I guess you can specifically talk about our county if that helps.
Mm-hmm. So in our county, we have been trending upwards, but it seems primarily among 4-year-olds. So I think the state has done a great job, and especially people in our county, at advocating to have more New Mexico pre-K, for example. But in other areas, we haven't seen a huge jump, like the rate of child care assistance subsidies has gone. It steadily has risen, but probably not where we need it to be. And also the children 2 years old and younger, we only have about 18% that participate in any sort of early childhood education.
Wow.
Which is very, very low compared to our older age groups.
So can you kind of break it down within the age groups? What are we looking at? You mentioned that 2 and under, there's hardly any
right.
Children enrolled in an early childhood education program, 2 and under. What are we looking at as far as like early childhood education goes with the age groups?
Yeah, so I would, the bulk of our children are probably about around 65% of 3 and 4-year-olds, but most of that is going to be in your 4-year-old group, is participating in some sort of program. But when, like I said, if you take all 5 and under, it's about 34-35%. We were just sort of finessing how we're also analyzing the data, because we were using a lot of home visiting numbers, and we're starting to look at that and say, okay, is that really a full-length program? Like, if we want to look at all-day programs, that number is going to go down quite a bit. So we're sort of in the process of doing that, refining what we're going to include as impact.
Tracking impact.
Exactly.
Why is it so tricky?
Because different programs do different things. You could have childcare, right? That whether it's in a home or whether it's in a licensed center, that can be all day, right? It can be half day, but for most kids, it's full day, because that's what the parents need. But then you can also have, these evidence-based programs like Pre-K and Head Start that are high-quality programs and also tend to be full day. But then you have areas like home visiting or early intervention. So home visiting and early intervention tend to target the birth to 3 population, which is great, because that's when so much of that, brain development takes place, and when you really want to be stepping in and supporting families. But you can't compare home visiting and early intervention to a Pre-K program. It's apples and oranges. And you could have a child in theory who is getting both. They can be getting early intervention and at a child care program. So early intervention and home visiting are specialized. They tend to be in the child's home or in the child's natural environment, and it can be a therapist that's going out and working with the parents on how do I improve my child's speech, or how do I respond to my child's cues appropriately, and build that relationship. And so it's different services, therefore different impacts.
Through your findings, though, what are some of the challenges in getting enough early childhood education to these kids in our area?
Well, one of the issues, I think, and really this is nationwide, is the integration and alignment. In New Mexico, for example, early intervention is called the FIT program. It's under the Department of Health. Childcare is under CYFD. Pre-K is under PED and CYFD.
Okay.
Public Education Department and Children, Youth and Families Department.
You're naming some federal national agencies and state agencies.
Right. So early intervention is actually part of the federal special education law. So Part B is the part that does special ed services, in the public schools. Part C is birth to 3. So that's a federal law that trickles down to the states. Then there's Head Start, which is purely federal. Then there's Pre-K, which is run through New Mexico. And so now, there's an alignment issue, right? And so in some ways it's hard to tell what the true gaps are and what the true funding needs are when you're missing, or when you don't have necessarily all the data from that alignment piece. And that is going to be really the challenge for New Mexico. So the good news is, or I think what a lot of us perceived as good news, is that this legislative session, the legislature finally passed the creation of the new Early Childhood Education and Care Department. And so that's an entire department devoted to early childhood, with a focus on birth to 5, that will take these programs that are under different state departments now and work on aligning them.
Okay. So how is the communication between the different agencies at the federal and state level? Are they on the same page?
Well, that's a good question. I think you could ask 10 different people that question and get 10 different answers. So I think New Mexico is really working on that, because even now, as they prepare for this new state department, which won't actually go into effect until next July, CYFD and the Department of Health, for example, they're working on creating the infrastructure for this new department. So I think there's probably pretty broad consensus across early childhood that alignment's an issue, right? No one wants to reinvent the wheel. You hear people talking about things like duplication of services, but really when you hear terms like that, you have to dive deeper. Because is it really a duplication of service, or is a child, for example, getting 2 different services that have a different focus? And so that is part of why we're so grateful to have our data people, because data can be used in a lot of different ways, and you want to make sure that you really understand the data that you're reporting on.
Are early childhood education facilities ranked in quality of care in New Mexico?
Yeah, do you want to take that? Or do you want me to?
Or could you explain how they are ranked? in
So
quality
we
of
have,
care?
we have a STARS rating system for childcare centers. So in New Mexico, we have a 5-star rating system. And so for a childcare to be able to offer, for example, state aid like childcare subsidies, they have to be at least a 2-star. And so if you're some childcare centers though are accredited. They do kind of the above and beyond with an accreditation, and that'll automatically get you like a 5-star rating. But New Mexico is interesting because you can have in New Mexico, you can have licensed childcare centers, but then you can also have people providing childcare out of their homes. And if they're providing out of their homes, they can either be a registered provider or a licensed provider. And so there are differences in quality of care.
What about the top rated facilities that offer early childhood education? How is our county doing compared to other counties within the state?
Like with 5 stars?
Yes.
Well, I know that about 40% of our children that are in subsidized centers are in a 5-star center, which I think is pretty good. I don't know how that compares statewide. I haven't looked at that, but we have been increasing in quality, at least according to the Focus star ratings. I think the big issue that Lori was mentioning is there's so much variation when you start to look at maybe home care providers, and we have a large percentage. It's around 21% of children are in a registered child care center. So that could be, your neighbor or a family member's home. And those types of care are super important for our community because a lot of people don't have transportation or the ability to take their child to a center, or they're in a more rural area.
I would imagine another thing that could be a challenge is just being able to afford childhood care.
Yeah, definitely.
How big of a challenge is that right now?
Right.
Well, you want to talk about the affordability numbers?
Yeah. So the cost of childcare for an infant for a month is around $900.
Oh.
And
It's a
so
mortgage payment.
Yeah.
so that's a lot. That's a lot of money. And you can find cheaper ones than that. That's the median rate for a metro area. But so a lot of families are reliant on the child care assistance subsidy. And that's where CYFD will pay for, or at least pay for all of or partial of childcare. But one of the issues with that is you have to show that you're actively working, or you're in school. And so I think the state is trying to work around, like, how do we deal with families that maybe are trying to go back to school or trying to work. So you get in the situation where you can't get the subsidy and you can't go improve your situation because you can't get the subsidy, and so it becomes a challenge, I think, for families. But I think that we're moving in a direction to where maybe we can. There's discussion about working that out.
What is the discussion happening right now with members in the community, policymakers, as far as like making it easier to have more families be able to work or go to school and still be able to provide an education for their children at a young age?
Well, I think conversations that are happening, I think here and statewide, are that you can't look at early childhood, for example, and economic development and workforce in isolation, right? An investment in things like childcare or childcare subsidies is an investment in our workforce. Because if you have parents and families who want to work, want to go to school, but they face these challenges, right? It's like a tripod. I need to have a job, but in order to make it to my job, I also have to have adequate transportation, and I have to have appropriate childcare. So if you think of that as like a 3-legged stool, any one of those legs falls off, you have an untenable situation. So we have to look at these things in a broader light. You can look at states like Texas that make huge investments in childcare, right? Because they view it as an investment in their workforce and an investment in their economic success.
So what is the difference, you think, between how much they're investing in early childhood education in Texas and what we're doing right here in New Mexico?
Oh gosh, that's a good question. I think Tracy would. So the Bridge of Southern New Mexico, which looks at they do a lot of workforce work here in Doña Ana County, and a lot of work that the rest of the state's emulating. And they've done just lots of research looking at what are the key industries here, and how do we build talent pathways to help our kids from Doña Ana County, see that you can make a living here and thrive. And so it's, they really are looking at the bigger picture, which is what we want across that prenatal to career spectrum, is we want people to have that bird's eye view and not just see their piece of the puzzle.
I'd like to what are the other issues with early childhood education that we haven't addressed right now? I mean, we've talked about availability, cost, and is there any other challenges that we haven't addressed?
So workforce is a huge one. So just like we have a massive teacher shortage in public education, we have a workforce issue in early childhood, and there's a number of reasons for that. Anything from low pay to low professional development opportunities to even just not reaching people in middle school and high school and talking to them about the field. So there's a broad spectrum of reasons why that's the case. And actually, do you know, and Erica could probably talk more about some of the data around that.
Just the fact that it's a child care worker earns about $20,000 a year in our county. So we have an issue. How are we going to get people to go into that industry if we're not willing to pay them a proper wage? And so I think that's a massive problem that we have, is finding the people to work in that industry and paying them a decent wage so that they stay, and giving them the professional development opportunities like Lori says.
Wow. So I'm kind of curious, with what we're looking at right now, one of the challenges obviously that we've talked about a little bit, and it's been like poverty issue, and being able to afford early childhood education. Could you kind of give us an understanding of what we're looking at as far as kids that are being born in New Mexico into poverty?
Well, it's, let's say 41% of children under the age of 5 live below the federal poverty level. But if you bump, that's below 100% of the federal poverty level. So if you took that up to 200%, it's about 72% of our population.
Wow.
So yeah, we have a lot of single mothers, and about 40% of births or 45% of births are to women who are single, and so just the economics there, and the families who with the youngest children really suffer the most.
What are some of the challenges that are ahead of us right now with this issue? We've heard a lot about reasons, funding, not being able to pay salaries enough, workforce, access. What are the challenges that we're going to be talking about next year with early childhood education?
Well, there's groundwork being laid this year, so I think people are expecting, hopefully any day now, that the governor will appoint the new cabinet secretary for this new department. And so they're working on setting the infrastructure in place for this. I think a year from now, we're going to be talking about alignment. Starting July 1 of 2020, that's when all these early childhood programs that are under these various state departments are going to be officially under this new department, and they bring their operating budgets with them. So I think funding is going to forever be an issue. Like, how do we continue to fund this, and how do we make sure that this new department has a presence in communities, just like we have, for example, public education. We have the school districts that have a presence in their communities, and CYFD has regional offices that have a presence in their communities. So I think one question is, how will people experience this department as a reality in their communities? Another is, just lost my train of thought.
Well, you talk about this department, and I've had some questions about this new department that they're planning on opening here, the new agency to address early childhood education and care. What are some things that people working in both those areas? What are some of the conversations like? Are there any concerns? Because rolling out a whole new agency to address this issue and still be able to work with all these other agencies, like the Public Education Department, CYFD. What are some of the things that the conversations about people? Are there any concerns about this happening so that it can be a sustainable agency?
Sure. You want to take that, or you want me to take that?
Well, I mean, I immediately go to the data piece.
Mm-hmm.
Maybe you can talk about
Well, I think
yeah,
that's
some other
yeah,
policy, but
yeah, but I think that brings up a good point because
Okay.
with something like this, data is going to be
Yeah.
very important
Huge.
because that's really how what's
Right.
going to bring everybody together to the understanding. So,
Mm-hmm.
coming from that perspective, I mean, what are some of the things that you see on the horizon?
So one of the biggest issues is that we haven't had an integrated database, and so there hasn't been an integrated database that incorporates data from CYFD, for example, the children in childcare, receiving childcare subsidies, with data from the Department of Health, which would be your FIT programs and your some of the home visiting and intervention programs, and then PED, the Public Education Department. So they have been working on a system, and I think that would really help enormously in our state to have all the data together and be able to look at it and see how children move through the system, or what things are working and not working, and also being able, if they share that data with departments like ours throughout the state that do similar work.
Your department, I
And,
don't think a lot of people may be aware of all the work that your department is doing to kind
Yeah.
of provide this data and information to these different agencies and community partners. Could you share with us a little bit more in depth about what you have going on right now? Because you're working on quite a bit
Sure.
of research.
Yeah, so we do, for example, one of our biggest projects is the early childhood. So so what I have to do is reach out to the different data people in these departments, bring that data in, and then analyze it. But it's all aggregated data. So that is stuff we provide, but we also do a lot of work like surveys. And so or focus groups. So we'll partner with Engage or the Bridge or the resilience leaders of Doña Ana County, and try to find out information from the source, like what do parents and families need, and then bring that back, analyze it, and give it back to the community members to make hopefully data-informed decisions.
With that information, when you have that data, when you have the research behind you, how easier is it to have these conversations with people that are making decisions?
I think so. One of the things that's such a gift about the Center for Community Analysis is that sometimes when you say data, people's eyes can glaze over, and they present the data in a way that it means something, right? You can see what the applicability is to you or your program usually right away. And so, for example, there's various ways we get this information out to the community. So Resilience Leaders, which is another collaborative in town that's working on how do we create, a community where adverse childhood experiences are prevented instead of just reacted to. And so that, has required really doing a countywide survey of what are people's perception of the resources that we have here, like what's considered preventive when it comes to adverse childhood experiences and what's kind of, more in the reactive realm. And so, most nonprofits and even, governmental organizations, not everyone always has an in-house data person. And that's where, the Center for Community Analysis can step in, and they can work with them to, basically to contract these jobs where they might not have that resource to get the data in a way that they know that they can apply it. They understand how the data came to be. So we can use it for different collaborative efforts. There's a group in the Success Partnership called the Leader Circle that's about 35 people, and it's a group of community leaders from across the county that have committed to using their influence to promoting the goals of the Success Partnership. So for example, last week at our Leader Circle meeting, we had all 3 of the superintendents present. And that's a big deal because we have, 3 superintendents in Doña Ana County, 2 of them who are brand new, and 1 in Gadsden who's been here, I think, a year and a half, 2 years. And so there's this incredible opportunity now within our county to have these 3 superintendents, pull these districts together, I think, in a way that hasn't been done before. And all 3 districts are doing some incredible work. And so they can pull on that data too, because Center for Community Analysis does prenatal to career. They did an education context report in 2016, updating it now to 2018, and we can really see our baselines. What happened in education in 2016, what was true, and what was true 2 years later. So there's so many uses for the data.
How, with all these people having a stake in this, and this partnership, what are the challenges in just really getting everybody in the same room and or in this on board with the same mission?
Yeah.
Because everybody's going to have their own perspective and ideas about
Yeah.
which way to move forward. So how do you pull that together? We just have a couple minutes left, but
Sure.
how do you make that all work?
Well, I think, there's things that would come up that you would expect. The big thing was that when Engage, and this was before my time actually, and Erica was around, but Engage pulled together, a group of they pulled together a big group of stakeholders, and everyone had a voice in the process. And so that's huge, because if you don't have a voice in helping create something, are you really going to have the buy-in? So that's where our community agenda came from. It started out as a conversation about how do we improve child well-being, and ended as there's one area we can focus on that'll really make a difference, and that's education across the spectrum. But the challenges that come up would be things that you'd expect, funding and sustainability. Data sharing can be tricky, as Erica can tell you, because sometimes people use data in a punitive way. And so we have to continually build relationships with people and build trust so that we show them we're building data for the betterment of the community. It's not going to be used against you, there's anything you'd add to that?
No,
Well,
I
we don't have
think
much
that's
time
right.
left, but it sounds like putting it all together. I mean, it's such a challenge, and it's such an important issue to the future of our state. I want to thank you both for joining us. Unfortunately, we're out of time.
All right, thank you.
Thank you.
And we want to thank you for joining us for Fronteras a Changing America. I'm Anthony Moreno.